Hi, I'm Dr. Ty Vincent, here to explain how we can use low-dose immunotherapy, or LDI, to treat celiac disease and severe gluten sensitivity in people. Other forms of immunotherapy have failed over the years to successfully treat celiac disease and to stop this particular kind of immune reaction. There's just something different about it from other sorts of food allergy. It must be a different mechanism, or maybe it has something to do with the molecule involved that's the target antigen. It's really not clear. But NAET, sublingual immunotherapy, conventional allergy shots, oral immune tolerance therapy, these things have not proven to be successful. I learned the technique low-dose allergy therapy 15 years ago in 2008, and that therapy also failed consistently to work for celiac disease patients or people with this severe kind of gluten sensitivity enteropathy. Nobody really knew why, but the theory I have is that using whole grains themselves, wheat, rye, barley, as the antigen, grinding them up, diluting them, just didn't present the antigen clearly or properly to the immune system so that it would stop that type of immune response. LDA worked great for treating other kinds of food allergy that included wheat, patients who have allergy to wheat, rye, barley, but the way they respond to those grains isn't exactly the same way as celiac patients respond. So over the years, it occurred to me that maybe if we used gluten itself, just ordered pure gluten, which you can purchase online, as the antigen, maybe that would work. So I've done that for a number of years now and have had extremely good success with that. Just as good as any other food allergy we treat, close to 90% success at completely stopping and eliminating the reaction to gluten so that people can eat it in abundance with impunity, have no reactions whatsoever. The process is just like we do with anything else in low-dose immunotherapy. You decide where to start in terms of the dilution of the antigen with the patient based on how sensitive they seem to be. And then you titrate through progressively stronger until their reaction goes away. So the way it works for the patient is to take the starting dilution, which you just squirt under the tongue, there are no injections, and about a week later, you have to test your reaction with some tiny amount of gluten, whatever the smallest amount of gluten is that elicits some kind of symptom reaction that you're accustomed to seeing. And then you can tell if the dose worked or not. If it didn't work and you still had a reaction of any kind, then we go on to the next stronger dilution and repeat the experiment a week later, and so on until eventually you find that individual's effective dilution using the gluten LDI doses. Once you have that, usually people can make it about 6 or 7 weeks in between doses with no symptoms at all, even if they're eating gluten every day. So the goal of therapy is not just to minimize the reaction to gluten or to just partially improve tolerance. When this works, which it works very well, as I mentioned, you can eat gluten as much as you want and have no reactions whatsoever in terms of an immune system reaction. Eating gluten-containing grains are kind of harsh, and some people have issues with digestion of this or that kind of food. That's a different issue altogether. But in terms of the immune reaction to the gluten, which looks like an allergy or like celiac disease manifestations that are systemic, multi-system, that stops. So it enables you to get your life back, be able to eat at restaurants without having to worry about it, to be able to eat processed food items without having to worry about it, to have pizza once in a while, real pizza, to socialize with friends and share meals together, all those things that you lose when you realize you have gluten sensitivity and you have to avoid that. It really broadens your life again. And that is an extremely meaningful and powerful thing for people that are suffering with this issue. So we are more than happy to help anyone out there who wants to give this a try. You can get a hold of us through globalimmunotherapy.com or look up my other YouTube videos, Ty Vincent LDI on YouTube, and find a lot more information about low-dose immunotherapy and how that works. Do more research that way, and then get a hold of us and we can help you out with this. Thanks.